I'm very excited to announce our One Health campaign, where the Farmers Journal and the Department of Agriculture are bringing you a whole series on AMR, Antimicrobial Resistance. What does that even mean? We're talking about antibiotic resistance, this whole topic that's affecting humans and animals globally. What happens if these antibiotics we treat our animals with, or treat ourselves with more importantly, stop working? We're going to help you understand what it is and most importantly, talk about this One Health idea and how it affects you.
My name is Caroline Garvin and I'm a vet working in the Department of Agriculture in the area of AMR. So what is One Health? What do we mean when we hear the words One Health? Well, One Health is a concept that's been out there for a number of years now, and it embraces the idea that we all share the same environment. Both you, me, the animals. We're all together in the one environment, which means we share more than that. We share the same bacteria, we share the same diseases, and most importantly of all, we are sharing the same antibiotics. We are using the same antibiotics to treat diseases in animals and in ourselves. As an exporting nation, we are highly dependent on the quality and the sustainability of our agri-food sector, and how we use antibiotics feeds directly into that. We know we need to use antibiotics in certain cases, but they must be used in a responsible way. And how we use antibiotics is now coming under increasing scrutiny because of this One Health issue of AMR. Consumers need to know now how their food is produced, how the animals are cared for when they are sick, and how we use antibiotics has never been more of an important issue for us and for you as farmers, but because it affects the whole economic side of the production system. So we all have a role to play, and it is key and it is so important that you look as to how you're using antibiotics in your production systems.
As Caroline said, this is about One Health. When I started understanding AMR, I started getting frightened. I started thinking about my own kids, my own family, my parents, and what effect a post-antibiotic era could look like when antibiotics don't work. Okay, on our farm, what if it doesn't work to treat pneumonia, that case of mastitis? But you've really got to think about you. You've got to think about your parents, your family, and yourself. Simple infections not being able to be treated by this precious resource that is antibiotics. That's what this campaign is about. It's about understanding why this is important for you, your farm, and your family.
AMR is such an important One Health issue for you, me, our animals, and our environment. As a mother, I have had direct experience where the antibiotics don't work. One of my children, when she was 8 years old, got a really nasty kidney infection. She went downhill very fast. And when I was in that hospital, I was so grateful that 1 out of the 10 antibiotics worked for her and she got better. If we don't all work together to keep antibiotics effective, we will have no disease treatment options in the future, and the outcomes will not be positive for us and for our families.